Good day, ma'am. So, today I'm going to perform the EINC return demonstration, or the Essential Intrapartum and Newborn Care. So, prior to the patient's transfer to delivery room, ensure that the mother is on her position of choice when in labor, and ask the mother if she wishes to eat or drink. And also communicate with the mother and inform her about the progress of labor, and gave reassurance and encouragement. And for the patient already in the delivery room, check the room temperature. And then ask the patient if she is already comfortable in the semi-upright position. Um, hello ma'am, comfortable naman po kayo sa inyong position ngayon? Okay. And then, remove all the jewelries. And wash hands and observing the proper procedure. So, I have already washed my hands and then arrange the things in a linear position. So, we have here the gloves, the bonnet, and the dry linen, the oxytocin injection, the plastic clamp, and the instrument clamp, scissors, and the 2 kidney basins. And then clean the perineum with antiseptic solution. And then put on 2 pairs of sterile gloves. And then encourage the mother to push as desired. 1, 2, 3, push. And then apply perineal support and did control delivery of the head. And then called out the time of birth and also the sex of the baby, and inform the mother about the outcome. And also place the baby on a clean dry cloth towel above the mother's abdomen. So the time of birth is 5:30 p.m. and it is a baby girl. And dry the baby from the face, and then the head, and to the trunk and the extremities. And then remove the wet cloth and place the baby or place the baby on the skin-to-skin contact with the mother's abdomen. Okay, and then cover the baby with a clean towel. And also, cover the baby's head using the bonnet. And then excluded a second baby by palpating abdomen, and use the wet cloth to wipe the gloves, and give oxytocin within the minute of the baby's birth, and dispose the wet cloth properly. And then remove the first set of gloves and decontaminated it using the 0.5% of chlorine solution for at least 10 seconds or for at least 10 minutes. For at least 10 minutes, and then palpate the umbilical cord and check for pulsation. So if the pulsation stop, clamp using the cord clamp at 2 cm from the base. And then using the another cord clamp, put it on the 5 cm from the base. And then cut near the plastic clamp. And then perform the remaining steps on the active management of third labor, and then waited for strong uterine contraction, and applied control on the cord contraction, also counter contraction on the uterus, and deliver the placenta. Deliver the placenta and inspect the lower vagina for any lacerations, and then examine the placenta for completeness and also for abnormalities. And then clean the mother's perineum and apply sanitary napkin or diaper. And then check the baby's color. Check the baby's color and also the breathing. And check the mother if she is comfortable and if the uterus is contracted. And then dispose the placenta in a leak-proof container or a plastic bag. And then decontaminated the instruments before cleaning, and decontaminate the second pair of the gloves, and then decontaminated the second pair of the gloves before disposal, and then advise the mother to maintain skin-to-skin contact with the baby. And then the baby should be prone and the head is facing on the one side near the breast, and advise the mother to observe for any feeding cues, and also support the mother and instruct her on the positioning, and waited for the full breastfeed to be complete. And then after a complete breastfeed, administer eye ointment, administer eye ointment and physical examination. Also give vitamin K, hepatitis B, and BCG. So administer eye ointment. And then the vitamin K. On the vitamin K, and then the hepatitis B. And lastly, the BCG. And then advise the optimal delay of bathing of the baby. And then advise breastfeeding per demand, and about danger signs for early referral. And then in the first hour, check the baby's breathing, also the color, and also check the mother's vital signs, and massage the uterus every 15 minutes. And in the second hour, check the mother's baby diet every 15 minutes, and complete all the records, and administer the eye ointment, vitamin K, hepatitis B, and BCG vaccine. So that's it for the EINC.